A viewer has a dog with a hip problem, and he wanted Dr. Wendy King to help with some on-air advice. So Dr. King is with Spears Creek Veterinary Clinic and here to help with that very thing. We're talking about hip dysplasia. What exactly is that?
So hip dysplasia is a malformation of the hip joint. So it's a ball and socket. You have the ball of the femur, and you have the socket of the pelvis. And it works really well together. But in hip dysplasia, that socket's really shallow, and the ball rattles around in there. Causes inflammation. That's arthritis. Inflammation of the joint is arthritis. But then what happens, if it happens for years, it'll be bone-on-bone grinding, and that causes osteoarthritis. That's bone arthritis. Very painful.
And we have a picture that you gave us of a dog, and you can see, is this why he's kind of lifting that left back leg?
No, actually, that's Haley, and I wanted to say she's an excellent example. She's a giant breed dog. And giant breed dogs and large breed dogs are predisposed to it. 80% of giant breed dogs have hip dysplasia. But the point that I wanted to show is nice and how slim Haley is right there.
She looks
She's very
beautiful.
slim.
She's a beautiful dog. And you want to emphasize the slimness because if a dog has hip dysplasia, your #1 recommendation is?
Weight loss. Weight loss. They need to be very svelte.
Okay, because otherwise it's just more pressure and weight on that area.
Exactly.
In addition to what dogs get it that you just mentioned, is there anything else we can do if a dog has it besides the weight loss? Like what kind of medications or...
Several different medications. Anti-inflammatories are very important. Also, I love joint supplements, glucosamine, chondroitin, things like that. Omega-3 fatty acids are great. There are a couple of surgeries that can be done. There's a salvage procedure. There's total hip replacement if you can afford it.
Oh, wow. Yeah, but for the most part, like a glucosamine.
Correct.
Now, when you talk about anti-inflammatories, the same kind that we as humans take?
No, they're special ones for dogs because dogs are predisposed to getting ulcers if you give them human.
So you would need to get that from your vet?
Correct.
Okay, great advice. And if you'd like to see this interview again, I will post it later on my Facebook and Twitter page. Those are the addresses right there. Dr. Wendy King is at Spears Creek Veterinary Clinic. Thanks, Wendy. Appreciate it. Weather's next.